Hello, this video is about the menstrual cycle, which is what prepares the uterus for a pregnancy, and as you will see, it is the feedback mechanism involving three different systems. This slide shows the three different cycles. First of all, the hypothalamic pituitary cycle, which involves the hypothalamus stimulating the pituitary to release FSH, or follicle stimulating hormone, and LH, or luteinizing hormone, which are going to then act on the ovaries. Then secondly, the ovarian cycle, which is going to be involved with, of course, estrogen and progesterone, and you can see how the estrogen and progesterone levels change throughout the cycle. And then, of course, the ovaries are going to develop and release the egg. And then the third, the endometrial cycle, which is involved with the lining of the inner cells of the uterus to build up a healthy environment to support an embryo should one be fertilized. You can see that the chart begins with day 1 of a woman's cycle and progresses through the month to day 28, and then begins over again with day 1. You can see through her cycle the levels of LH and FSH and levels of estrogen and progesterone, as well as following through the cycle the development of what happens to the ovary and to the endometrial lining. The first cycle I'll speak about is the hypothalamic pituitary cycle. Notice that at the end of a woman's cycle, looking at this estrogen and progesterone, the estrogen and progesterone are both quite low. This low level of estrogen and progesterone signals the hypothalamus to secrete GnRH, or gonadotropin releasing hormone. The gonadotropin releasing hormone then signals the anterior pituitary to secrete follicle stimulating hormone and luteinizing hormone, and those in turn are going to signal the ovaries to begin developing the ovarian follicle. And the follicle is what will make estrogen. As the luteinizing hormone increases around mid-cycle, it signals the ovary to release an egg or an ovum within about 24 to 36 hours. And after that, this empty follicle is going to develop into something called the corpus luteum, and the corpus luteum is going to produce estrogen and progesterone. The progesterone is going to signals the uterine lining to maintain this blood supply. If there is no fertilization, then this corpus luteum is going to degenerate and regress, and thus the estrogen and progesterone levels will fall, and that signals menstruation to occur. If a pregnancy does happen, then the embryo is going to make HCG. We'll see HCG later when we use it to test for pregnancy, and that's going to trigger the corpus luteum to continue to function rather than to degenerate, and so it'll continue making estrogen and progesterone, and that will support the blood lining that's in the endometrium to nourish the ovum, and it will continue doing that. The corpus luteum will continue making progesterone until the placenta is mature enough to do, which happens at around day 17 after fertilization. When this ovum is released, based on the spike in luteinizing hormone, the egg is going to be fertile for about 24 hours. Now we'll talk about the ovarian cycle. Notice that in the ovarian cycle there's two phases, the follicular phase and the luteal phase. The luteal phase is 14 days long, so in other words it lasts from ovulation, that spike in luteinizing hormone, until the woman has her period. If a woman's period is shorter or longer than the average 28 days, it's the follicular cycle that varies in length. Before ovulation, the follicle stimulating hormone signals a follicle to begin to mature, and within that follicle, about 1 to 30 follicles develop in each ovary. When there is the surge of luteinizing hormone, one specific follicle will begin to mature and then release the ovum called ovulation. And that empty follicle, as we said before, turns into the corpus luteum. The corpus luteum then matures and secretes estrogen and progesterone. And if implantation happens at around day 8, this causes the placenta to develop, which is then going to make an estrogen and progesterone. And if not, the estrogen and progesterone decrease, and menstruation occurs, and that drop again signals the hypothalamus to begin the process again. Now the endometrial cycle, which is the cycle of the lining, the endometrial lining building up a blood supply and then releasing it each month. The average is about 28 or 29 days, though it can vary from 21 to 35 days. It is greatly influenced by things such as a woman being sick or very tired, fatigued, if she has a lot of stress or anxiety, or if she is doing enough vigorous exercise that her body fat has decreased to less than 10% of her body weight. The average period is about 2 to 8 days long, and the average blood loss is about 25 to 60 mLs. The estrogen from the follicle stimulates the growth of the endometrial lining, which is going to grow to about 1 to 2 millimeters deep, and the endometrial glands are going to enlarge because of the stimulus of the estrogen, and then the progesterone is what actually maintains the lining. So notice that we have an increase in progesterone mirroring the increase in the endometrial lining, and then this spike of progesterone so that that lining stays maintained. If implantation occurs about 7 to 10 days after ovulation, then the luteum will continue making estrogen, and the endometrium is going to develop under the stimulus. If no fertilization occurs, then the corpus luteum regresses because it doesn't have any signal from the fertilized egg, and so there will be this drop in estrogen and progesterone. That causes vasoconstriction of the blood vessels that are in the lining of the endometrium, and so what happens is the blood supply to the endometrium is blocked, and that tissue necroses and sloughs off. And of course, there's a basal cell layer here that's maintained. So it's interesting. It's different from a wound in which actual healing needs to occur. There's no healing because there's no actual wound. It's this increased blood supply and tissue that just sloughs off.